my name is Chelsea Howard, and I will be discussing the healthcare in Germany. Germany actually has a universal multi-payer system, which I personally thought was interesting. The way that their healthcare is delivered is that health insurance is mandated for all citizens, and the public system is funded by employer and employee payroll tax as well as through general tax revenue. So the government actually has little to no role in the financing or delivery of the healthcare services. So there they call their health insurance sickness funds, and coverage is available through public health insurance, private health insurance, or a combination of the two. About 86% of the population, so roughly 70 million people, receive their primary coverage through the public health insurance. 11% receive health insurance through the private health insurance market. The requirements for public health insurance are actually pretty simple. Any citizen who has an income below a fixed limit qualifies for public health insurance. So in 2016, this limit was $71,564 US. If their income happens to exceed this limit, then they can still pay the fixed percentage of 14.6% of their income, or they can pursue private insurance. Everyone under this insurance, they not only have the right to medical care, but they also have the right to the payment of their wages when they are ill, which I thought was really impressive. People who qualify can choose among the public health insurance companies to select the right coverage option for them. And I also thought this was really cool that they are able to actually go through and select between, I believe, 46 different health insurance companies to pick the right option for them. The requirements for the public health insurance are also pretty simple. People who meet and exceed the gross income threshold to qualify for public health insurance can seek private health insurance. And those who wish to purchase supplemental private health insurance in addition to their public health policy are able to do so. This is if they decide they want expanded care outside of what their public health insurance offers. Additionally, the private health insurance premiums are not based upon income. They're actually generated by age, general health, and the requested healthcare services. And so because of this, the younger, healthier individuals tend to have a lower premium, and those with pre-existing conditions tend to have a higher one, or those who are geriatric. So because the government does not play a role in the delivery of healthcare, they actually have self-governance there, which I also thought was interesting. So insured individuals can freely choose their providers, so that creates a competitive market. The Federal Joint Committee includes representatives who represent not only the patients, but doctors, dentists, etc. So the facilities, the patient, and providers. The main role of the Federal Joint Committee is to provide oversight. So they define the rules for access to and the distribution of healthcare, benefits coverage, coordination of care, quality, and efficacy. So what is the quality of healthcare there? The main quality stems from the self-governance. So the pros to that are you have less waiting times, decreased shortages in staff, and also access to high quality care. The cons to self-governance are that it lacks coordination of care. So Germany has 3 different components to its healthcare, which is outpatient care, inpatient care, and rehabilitation facilities. And they lack communication between the 3. So this also equates to a lot of waste within healthcare. Additionally, it's not as cost effective. So you end up with an oversupply and an abundance of care, and also an excess number of inpatient cases. The cost of healthcare in Germany is pretty easy. It's a set 14.6% of an individual's gross income. And then anyone earning outside the income level must pay the same level premium, so that 14.6%, but the cost can also be shared equally between the employer and employee, or 7.3% each. And then as stated before, the costs for private insurance plans are based upon the patient's demographics, not income. So that's their age, general health, and the requested healthcare services. Choice. So it is actually illegal to be uninsured in Germany. So if you are caught without insurance, you will be fined with back payments covering the entirety of your stay in Germany. All employees' income who does not exceed the set limit must have health insurance. through the public exchanges. And spouses and children who earn little to no money are covered at no additional cost to the dependent. And that is it. Thank you so much.